Hi, I'm Sierra and I'm a speech language pathologist. I've gotten a few questions about something called puberphonia. It's a voice disorder where the pitch of the voice is higher than normal. This can happen with men and women. So it's what's called a functional voice disorder. That's the category, meaning that it's more behavioral. There are a lot of different strategies that can help to bring the pitch down, but I'm just going to give you a taste and go through a few of them. So one of the first things I do with most voice therapy patients is start with the breath. Learn how to breathe from your diaphragm to give it a good energy, because no matter what you're doing up here, if you don't have adequate breath support, it's going to make everything worse and it's going to be working against you. So once you have your breath down and you learn how to have good, controlled diaphragmatic breathing, then you can move on to the next thing. So what happens with puberphonia is there's some sort of tension that's holding the larynx up higher than normal. Now, it's behavioral, meaning there's usually some sort of psychological cause. And so what we want to do is we want to retrain the body to react differently. The first relaxation technique is called a yawn sigh. So open up your mouth nice and big, take a deep breath like you're gonna yawn, and then let out a nice, easy, natural sigh. It's nice and breathy and airy and relaxed. Try to go from high to low, like you're at the end of a long day. So that's gonna, one, relax the muscles and decrease tension, and it has the added benefit of trying to go lower with the pitch. Another relaxation technique is sit breathing. Now what that's gonna do essentially is relax the vocal cords, because as you sit out and close off the mouth, that forces the air back, creates a negative pressure, and it kind of forces the vocal cords open. Next is not a relaxation technique, but it's actually a manipulation technique. So what I want you to do is find your thyroid notch or your Adam's apple. Everyone has them, men and women. It's the most prominent notch on your throat that comes out right there. And you're going to push very gently while making a sound. And you can make an ah sound. Ah. Do you see how just doing that lowers my voice? Well, it's very similar to like a bass string instrument where the deepest string note is thicker and it's looser. And essentially when the chords are taut like this, they're gonna have a higher pitch. But when you push, it gives it a little bit of lax and therefore lowers the pitch. Next seems pretty obvious, but it's something that could really help someone with puberphonia. What you're going to do is you're going to glide from as high as you can go to as low as you can go, just with a hum. Like that. And what I want you to do is on the way down, really focus on dropping everything, lowering, opening up the mouth, bringing it forward. Oh, like that. Make it a goal to get lower and lower as you do that exercise. If you know someone who has a higher than typical voice and doesn't like their voice, let them know that speech therapy can help. You definitely want to use a speech therapist because they're going to actually allow you to speak with your new voice all the time. Thank you so much. Please subscribe so you know when I have a new video out.